Welcome back to Capitol Hill Update. I'm really excited to be back with you guys. I honestly wish I had better news to bring with you to you, but this is the week. Everything I told you last week about when we're expecting the vote remains very much the case. We understand that Leader McConnell is very firm on wanting to have a vote at the end of the month, and so we are expecting a vote next week. And yes, it's next week, so this is the week. This is the week when you should be calling your senators every day, because this is our last chance to convince undecided senators how important it is for them to oppose all of the bad things that are in this healthcare bill. I was very pleased. This morning we had a briefing co-sponsored with the ACLU and 5 amazing disability champion senators to talk about exactly how harmful per capita caps will be for people with disabilities. Unfortunately, my fun new piece of congressional information is that apparently the Senate is looking at even deeper cuts to the Medicaid program through a couple of tweaks to the per capita cap growth rate. We saw something very similar in the president's budget, which cut an additional $6 billion out of the Medicaid program. This is one of the major challenges with having a cap on Medicaid spending. Medicaid spending right now is based on actual healthcare costs. You go to the doctor, Medicaid pays for it. What the caps do is disconnect that and instead base Medicaid spending from the federal government on a particular number. And that number can change. We saw the president's budget propose a change. We see this proposing a change. I mean, that is going to be our fight from now on if this part of the this proposal becomes part of the Medicaid program. We are just going to continually fight over what number that is. And that's not good for beneficiaries. That's not good for people. That's not how to run a healthcare system. So that's my bad news for the day. My good news is that you can make a huge difference in this. We have senators who are incredibly undecided right now. Cory Gardner from Colorado hasn't said anything about this bill. We've met with his office. I know a lot of local advocates in Colorado have met with his office, and he expresses concern about some of the provisions, but hasn't publicly stated what his position is. You can get him to change that. And so in addition to calling your senators every day, I have 2 other things that I just wanted to make sure you know can be really effective ways to contact your senators. The first one is writing letters to the editor. It might seem a little daunting, but I promise these don't have to be long. They can be really short, sweet, and to the point. This is my name, this is where I live, and this is why Medicaid is important to me, important to my family members, important to my friends. That's all you have to say. And you'd be amazed how carefully senators pore over letters to the editor in local papers. And then the second piece would be calling your friends and family. I have a lot of friends who live up in Alaska, quirk of going to Duke Law School, and I've contacted them and I've told them that I'm really worried about this. And that's really all you have to do. Think about who you know in states that matter a lot. And I said Alaska already. I'll also throw in Colorado and Nevada and West Virginia and up in Maine, all of those states. But really, if you know anyone who has a Republican senator, we only need 3 votes. I know Senator Shelby in Alabama has expressed serious concerns about the per capita caps. Give Senator Shelby a call. We also have provided some additional information on our website. Some fact sheets, state-specific information about the number of people with disabilities on Medicaid in your state, the number of children on Medicaid in your state, things that you might want to have when you call your senators and when you write these letters to the editor. Please feel free to check those out. If your state isn't on that list and you'd like a fact sheet, let me know. Feel free to email me. I'm happy to create them if it would be helpful for you. And please send them to your friends and family. So good luck with all this, and thank you so much for everything you guys do.